Yeah. So, can we see the screen or not yet? I would like to ask you, could you please switch off the big lights, because it will be better seen. All right. Thank you so much. Okay, let's start. And today, you remember, we have 2 lectures at 9 and 11, because previous week, guys, none of you were here. So that was the funniest part. No one came for the lecture, but okay. So, and that's why I will be going through the lecture today, and it is both of the lectures would be dedicated to the lower limb, because we need to finish the part of the lower limb. At the same time, I will say important message that in case of your final exam, everything what we have covered in anatomy will be there. Simply, from the very first day where we had the introductory part to anatomical medical terminology and so on, then continued, I don't know, with the back, upper limb, this lower limb, thorax, abdomen. This everything will be simply included in your final exam. Okay? Good. Okay, so we started to talk, if you remember, about the anterior and the medial regions of the thigh, and I just talked about the anterior one on our previous lecture, and now I will continue with a portion of the medial region of the thigh. And what are these particular muscles? We can simply find here. So here we do have the very interesting picture, and this is the figure 5.23, which contains several pictures, such as picture A, which represents the anterior view just of the skeletal portion of the thigh. Then we continue with the picture B, C, D, which shows you the different types of the medial compartment muscles, and then it continues with the rest of the pictures. So here, starting or continuing, let's say like that, our explanation previous lecture that we had, saying saying that the part of a thigh, if we compare it, for example, to the arm, I'm just saying about comparison and some similarities, yes? So we remember that, again, yeah, we have subdivision to the anterior posterior compartment, but we do have here additional one, which is known as the medial compartment, yeah, in the region of the thigh. So that's why what we've talked previously about was just the anterior compartment. And how did we call the anterior compartment? It was associated with the flexion of the hip and the extension of the knee, because you remember that the knee is the type of the joint, okay, which is, we could say, is exceptional in the way of the movement and its terminology, because you remember flexion and extension when we were explaining that part. We said, okay, the description of the flexion was decrease of the angle of the joint, and in case of the extension, it was increase. At the same time, we said that mostly at any region of our body in anatomical position, flexion is anteriorly directed movement, except for one of the biggest exception is the knee, where the flexion, so this decrease in the angle of the joint, is represented posteriorly or directed posteriorly, and extension vice versa anteriorly. So that's why in case of anatomical position of a lower limb, in case of a thigh, the anterior compartment would be flexion, so will contain flexors of the hip and extensors of the knee. So that's how it works. Additionally, here, as we said, we do have, besides the anterior posterior compartment, we do have the compartment which is medial, so medial compartment of the thigh. And here we do have part of the adductors, and what I do believe it's also logical, because we've talked about that, and when we say about particular compartment, when in anatomical position, we need to think about where exactly it is moving or how it is moving, simply to say. So that's why here we do have the several type of the muscles, which are having very simple type of the, could you please close the door? Thank you. So which simply have a very logical titles, and these are the adductors. They are adductors, simply to say. That's why we can say that we have adductor longus, brevis, and magnus, big one, simply to say. So that's how we call it. That's what's very well seen here in the pictures B, for example, for the adductor longus, C for the adductor brevis. You can find here the picture E. Yes, on picture D it's not seen well, but picture E shows you the adductor magnus. Picture F is also very well shows you the adductor magnus, and two more type of the musculature that you can find in that particular compartment would be beautiful gracilis and a very small type of the muscle known as obturator externus muscle. So as a result, these all are mainly associated with one type of movement, and sure, it is the adduction. So adductory type of the movement can be found here, okay? And the most interesting thing, to be honest, in this case is that what about the attachment? In all of the cases, when I say adduction, now the question is adduction where? At the hip joint. If you talk about the hip joint adduction, then what happens? So it means that the attachment, which is proximal attachment of that muscles, should be associated with the hip bones mainly, yes? So that's the only thing which you can find there. So that's why you can find that mostly medially and anteriorly localized structures such as pubic bone, as you remember, with its rami, will be representing the most common point of the proximal attachment of that muscles. And to be honest, it's literally like all of them. All of them we have the similar type of the attachment. That's why if you go back to the explanation, it's very easy to memorize, okay? So the regions for the attachment, because you can find that starting with adductor longus, which is the most, I would say, even medially oriented, then towards brevis and then magnus. In all of the cases, it will be pubic bone, so the part of the pubic region, either it will be the body of the pubic bone, as you can see here, or it will be the inferior rami, as you can see here. So it's just simply very logical, because as you pass from medial to more lateral regions for the attachment, sure, from body to the rami, yes, simply to say. So that's why it's very easy to memorize. You don't even sometimes need to reread it, because like there is no any other weight, first of all, for the attachment. Either it will be some part of the hip bone, and this is the pubic region in this case, and plus if we talk about longus, brevis, and then magnus, so from more medial to more lateral region of the pubic bone, it will have the attachments. Is it clear what I'm saying? I think that's very logical, yeah, also. So just to memorize it easily. From the other side, now what about the attachments which are distal ones? So in here we do have very nice pictures. So coming back to the picture A, where sure you can find both the attachments which are just schematically represented, the regions or locations of the attachment which are proximal and distal. And you can find, yeah, proximal we already have talked about, and now the part of the distal attachments. First of all, what can we see here? We can find that every and each of the muscle is demarcated by particular schematical color. which makes it easier to understand the exact attachment, but it's really also very easy to understand. Why? Because in case of adductor longus and brevis in both of the regions, as you can see here, in both of this parts, yeah, it will be simply attached on the same line. But if we say that adductor brevis is shorter, so it will be more proximally oriented, just because it is shorter. So just smaller region or smaller distance is covered by that muscle. And as we are passing distally through the femur, we can find that the next one would be bigger structure, which is adductor longus, and the last one but not least, which is not seen here well but is seen in the picture E and F, you can find the adductor magnus. So magnus, where magnus simply designates that it's something very large. Okay, so that's how it works. Now, when we talk about the adductor magnus, it has a very interesting structure, and you can find it here. Sorry. You can find it here. So you can see from the posterior view or from the anterior view, this is the adductor hiatus. So why? Because here we do have the part of the tendon which is associated with the adductor tubercle of the femur, which is always localized on the medial surface of the distal part or distal end of the femur. And here we do have simply the opening. That's why we call it adductor hiatus. So simply the opening in the adductor muscle. So as a result, this particular adductor hiatus is the one, sure, where we do have the passage of the neurovascular bundles. So we're talking about the blood vessels, the innervation, and so on. So you will see that later in the third semester when you'll be going through the blood supply of the whole lower limb, you will find that this is one of the regions where we do have the passage of the main blood vessels. But okay, so this is one interesting part. That's why if we go back to this picture, picture A, it shows us very well the part of the adductor tubercle particularly, and you see the color which is orange, let's say, where you do have part of the adductor magnus, as you can see here. So it passes towards the adductor tubercle. So that's how it looks like. At the same time, we do have one of the most, if you ask me, one of the most beautiful muscles of our body, and this is particularly the gracilis, which literally represents like the medial wall of the thigh, as you can see, and the part of the gracilis is very interesting. Why? Because if most of the muscles, as you can see here, it will be adductor brevis, longus, or magnus, mainly have their distal attachment at the femur again. Okay? In case of the gracilis muscle, it is the tibia. So we're talking about the crossing of not one joint now, but two joints, yes? So because in this case we do have the crossing of the hip joint and then the knee joint. So that's how it looks like. So that's why here we do have very nice demarcation in beautiful pink color. You can find it here, so closer to the portion of the tibial tuberosity, so this projection, we do have here the attachment of the gracilis muscle. And the last one but not least, which is also very beautiful and very small type of a muscle, this is the one known as the obturator externus muscle. And you can see it here in this particular picture. So it's very small, literally very small type of the muscle, and that's why it's not even associated with the portion of the thigh itself, but it is mainly associated with the portion of the hip, and particularly the obturator foramen of the hip bone. So as a result, here we do have this particular attachment. That's how it looks like. Now the question is, what type of the movement or action do you expect from these muscles? From the name, it's already clear. First of all, it's medially oriented muscle, and if it's muscle, sorry, and if they are medially oriented, so main type of the movement should be adduction, so the medial movement. But you remember that because we talk about the hip joint, which is ball and socket, yes, besides of classical adduction, you should have also some medial rotation in this case. That's why you can see that, yes, all of them will adduct, even in some extent they will be flexing the hip, the femur or thigh at the hip joint, but at the same time we will have some of the rotation of the hip, of the femur at the hip joint as well. But mainly sure it should be the adduction, okay? So that's how it works. So that's why it's always simple. Why I'm trying to explain it in that way, I don't want you to think about each muscle as a separate structure, because in reality they don't act separately. Okay, it's very difficult to find them acting separately. It's the group of the muscle. Okay, we have prime movers there always, and the others are helping or assisting, simply to say. All right, such as, for example, if we talk about, I don't know, adductor magnus, a huge part of it. Very interesting thing that adductor magnus, if you will go back to this picture, you will find that according to its attachment, it's not only passing as the part of the medial compartment, but it passes posteriorly to in the thigh region. So the question is, you can see here, this is the posterior part of the adductor magnus. So that's what we call hamstring part. Why hamstring? Because you will see that in case of posterior compartment, which is one of the smallest, to be honest, compartments in case of the thigh, you will see that mainly all of the muscles that can be found there are known as hamstrings. One of the most common type of the muscles which are found in the sports injuries. For example, football, soccer. Yeah. So yeah, that's how it works. What I wanted to say here more, yeah, because I forgot to say this part. Because I said about the hamstring part, saying that the hamstring is the posterior compartment, yes, or posteriorly oriented compartment. So clear that if anterior thigh muscles were performing the flexion of the thigh at the hip joint, yes, then the posterior compartment would produce extension of the thigh at the hip joint. Am I right? So sure, you expect that the hamstring part of the adductor magnus, which is posteriorly oriented at the level of the hip joint, will produce the posteriorly oriented movement, which is extension. Thank you very much. I think it's very logical, yes? So that's why this is one big compartment of the muscles which are performing the similar type of the movements. I will come back to this one picture, but before that, let me talk and let me finish with the posterior compartment, and then I will come back to this picture, because here we have the muscle which is also represented in the posterior compartment, okay? So here first, let me say about the posterior thigh region first, and then I will come back to that part. So here we are. This is the figure 5.4t, muscles of the posterior thigh. I'm just talking right now about the thigh. Forget about the gluteal part, because I didn't talk about the gluteal part yet, but I will say about it as well. So this means that anterior portion, we already know that this bulk is mainly dependent on the presence of which muscles? anterior one, this bulk, what is dependent on? Quadriceps, mainly. So, besides of that, what else do we have? Sartorius muscle. What else do we have? Sorry? Iliacus, but I'm talking about this region, the region of the thigh, anterior one, and this bulk, what is composed of? Iliacus, you sure? I don't think so. What else? Did we do our homework? Yeah, but this is the quadriceps muscle, yeah? All of the 4 parts of the quadriceps muscle. That's all? Only quadriceps muscle do we have there? Okay. So, the posterior compartment of the thigh is really, okay, compared to anterior compartment, much smaller. And you can see that mainly the type of muscles that you can find there are 3. These are biceps femoris, and yes, I'm saying biceps, but it's not biceps, yeah, brachialis, which is the part of the upper limb. It's biceps femoris. Second one is semitendinosus, and the third one is semimembranosus. So these are 3 main type of muscles that you can find in the posterior compartment of the thigh. Okay, and particularly in the picture G and H, okay, particularly the H is the best one, to be honest, from the lateral view, to see the long head of the biceps femoris muscle and the short head of the biceps femoris muscle. And you can see one thing, that long head of the biceps femoris muscle is crossing 2 joints. One is short hip and one is short the knee joint. Why did I say that? I mean, why did I mention that at all? Because here comes the understanding of what are the hamstring muscles and how do we group them, or how do we characterize them. Well, one of the important characteristics of the hamstring muscles is that all of them are crossing both of the joints, hip and knee. That's why you can find here that having the portion of the biceps femoris, as well as semitendinosus and semimembranosus, which is very well seen here. You see, this is the part of the semitendinosus, or from that side it's also very well seen. And here is semimembranosus, which is better seen in this case because it is literally overlapped by the part of the semitendinosus here. So what is interesting? You can see that all of them are literally crossing both of the joints. This is one important thing for the hamstring muscles to be a group of the hamstrings. What you will say, okay, you yourself said that there are only 3 muscles, yeah, in the posterior compartment of the thigh. Then saying or characterizing them as particularly the hamstring muscles, so it's clear that all of them should be the hamstring muscles. Well, no, it's not like that, because in the correct way or anatomical way of the grouping of these muscles, you can see that it's only the long head of the biceps femoris is the one which is included in being the hamstring, in being in the group of the hamstring muscles. Did you understand? Are you following me, guys, there? No? Yes? without the talking. Okay, let's continue. So this part was clear, yeah? More or less, I think that, yeah. So as a result, when we talk about the part of the hamstring muscles, now let's logically think. What type of the action do you expect to find in case of the hamstring muscles, sorry. So what do you expect to find? What type of the action, I mean the movement? Extension. Where exactly? Sorry? I can't hear well, sorry. Extension of the hip joint, you say? Okay, maybe. Knee joint. Anything else? Guys, first of all, it was written here, to be honest, but okay. Logically, if you talk about the posterior compartment, which is antagonistic to the anterior compartment of the thigh, an anterior compartment of the thigh, which also crosses the hip and the knee joint, and is known as flexor of the hip, but extensor of the knee. This is anterior compartment. So in case of posterior, you will have vice versa. You will have extensor of the hip, but the flexor of the knee. Plus why these two? Why not flexors and extensors? Yes, as it was in case of the upper limb. Because in case of upper limb in anatomical position, it was clear. Anterior compartment, flexors mainly. Posterior compartment, extensors mainly, yes? Just because of the one thing, as I said in the beginning of today's lecture, as I reminded you that, yes, anteriorly oriented type of movement is the flexion, that's true. But just in the region of the knee, yes, which is rotated type of the structure, we have flexion, but it's posteriorly oriented. So that's why, in case of the anterior and posterior compartment, you see we have some difference. Difference of what that? In anatomical position, you do have muscles which are flexing the hip, but extending the knee. Posterior compartment is vice versa, yeah? Extending the hip, but flexing the knee. You see? So that's the idea here. So that's why you can find that, like semitendinosus, semimembranosus, and short, the long hand of the biceps femoris muscle, all of them are making literally the same thing. All of them are extensors of the hip, but the flexors of the knee. That's why you can find that, yes, they will extend the thigh, they will sure flex the leg at the knee joint, and important thing that we will have some of the rotatory type of movement as well. Well, yes, but only in case if we do have the knee which is flexed, because the knee joint is the type of synovial joint which is like it's very similar to elbow joint, so we're talking about the hinge type of the joint, yeah? But compared to the elbow, it is a bit modified, and because of this modification, anatomical modification, we do have some sort of the rotation, okay? Although the rotation doesn't mean that it's the classical movement of the hinge joint. As you know, it's not, yeah? It's just a flexion and extension normally, because the hinge joint is not having a big range of motion in any case. Like whatever, how big it won't be, doesn't matter. It's mainly flexion and extension. So why did I show you that? I mean, why did I talk about that part? Yeah, and the proximal and distal attachments here are very simple, to be honest, and it's very easy to memorize because, again, hamstring muscles, I said, one of the important characteristics is that, yes, they are crossing two joints simultaneously. The second important characteristic is that their proximal attachment is the same. Okay? And yes, it is the ischial tuberosity. It will be semitendinosus or semimembranosus, or it will be the long head of the biceps femoris muscle. Okay? So literally doesn't matter. So in all of the cases, it will be the same. Only biceps femoris short head is different. This one is the part which is different, and here we do have the posteriorly oriented linea aspera, which is clear, yeah. So, and as a plus, if you will see here, look. So from the lateral view, it's very well seen, to be honest. You can see how it is literally passing through the length of the linea aspera and passing towards the supracondylar region of the femur. Why supracondylar? Because in other case, then it will be passing already towards the condyles here. So it's also very well seen in this case. You see, this is the picture showing you how it is attached. You see? So it literally passes in the lateral leap of the linea aspera. I mean, the short head of the biceps femoris muscle. So that's how it works. Now, we start to say about the attachments, but we didn't say one interesting part, and I would like to show you back again the picture which I showed you prior, and here it is. So this is the figure 5.24, and it shows you the attachment which is known as pes anserinus, which is literally we can translate it as the like a goose foot, let's say like that. So, and here you can find that. How many compartments do we have in case of the thigh? 3. Anterior, posterior, medial. So, taking from each compartment one muscle, beautiful, very beautiful sartorius muscle, the medially represented gracilis muscle, and posteriorly represented semitendinosus muscle. All of them are passing towards the proximal head of the tibia. Yes, all of them cross the knee joint on the medial aspect of the anterior surface of the tibia. And this region where all of these 3 tendons are, we could say they are fusing into each other, is known as pes anserinus. So that's how it looks like. So you see all of the 3 compartments are represented in the same point of the attachment. It's not about even being similar. It's literally the same point of the attachment. Okay? Are you with me there or not? Yes? You here? Okay. All right. So that's how it works. Okay, before I will continue with the region, gluteal region, let's have some rest, some coffee, and let's continue in 10 minutes.